Scientifically speaking, we're sharing the view. From labs to clinics, breakthrough shining through. With minds that inspire and stories to unfold. Scientifically speaking, the future's being told.
Welcome to Scientifically Speaking with Christine on Oz Arab Media, where we explore the latest health, wellness and science in a way that everyone can understand. Today we're diving into the world of aesthetic medicine, a field that is rapidly evolving with non-surgical treatments that help people look and feel their best. Joining us today is Dr. Rabih El Khoury, an experienced medical practitioner and the director of Sydney Esthetics Clinics in Bankstown. With over 8 years of clinical experience, Dr. El Khoury offers a range of treatments designed to rejuvenate the skin, restore hair, and enhance facial features without the need for surgery. From anti-wrinkle injections to PRP therapy and body contouring, we will be breaking it all down today. Dr. El Khoury, welcome to the show.
Thank you, Christine. Thank you for your nice introduction.
Oh, no worries at all. I hope I gave you the justice, but we will talk more about all the things that you can help us with today.
Sure.
Starting with aesthetic medicine, it has gained so much popularity recently. And can you please explain to us what's the difference between that and the traditional plastic surgery?
Yeah, sure. Certainly, the aesthetic medicine has gained a lot of trust from the community and a lot of demand, simply because it simply makes someone look and feel better.
Amazing.
So we have simple treatments, which is non-surgical mainly, and mainly we concentrate on the face by first concern, but still we have other treatments for the body. So it is a popular treatment. Most of people are looking to look better and feel better. So why not? If there's something available, why not?
And no invasive surgeries, as we mentioned in our introduction.
Yes,
so
yes.
it's kind of safe.
Exactly. So look, most our treatments are very safe. We have to do it in the right way because we have very good products at the moment.
Amazing.
And yes, it's many even plastic surgeons now are doing the anti-wrinkle, anti-injectables without needs for surgery.
That's great news. A lot of people think that aesthetic surgery or treatments are for celebrities only. Can you please let us know who is eligible, who actually works for them?
Yeah, exactly. So look, anyone can have aesthetic treatments. There are a very few contraindications where we cannot have it.
Right.
But I would say 99% of people can have it. And even nowadays, things are more affordable than before. So many people are coming to get it for different ages. And it's worth it, I believe.
It's worth it. So anyone and everyone really can do an aesthetic treatment.
Yeah, so we have a few exceptions. For example, people with certain medical conditions.
Right.
They have some conditions they cannot have, for example, anti-wrinkle.
Okay.
Mainly talking about people with connective tissue diseases and, for example, myasthenia gravis. They are very rare conditions. So I would say most of the people can do it.
Amazing. What are some of the most common concerns that people come with to you, and how can non-surgical treatments really help them?
Okay, look, most people have one concern or two in their faces, and they usually worry about it the most.
Right.
So firstly, it's very important to listen what the client or patient is concerned about. Mainly, people nowadays, mostly, we're seeing some changes related to weight loss.
Yeah.
So if you hear about
Story
the
of my
Ozempic
life.
face,
Yes.
people lose fat in the faces,
Right.
and then the shape they make them look older. So that's mainly the most concern we're seeing nowadays, besides just some wrinkles and frown lines, is fat loss and change in the anatomy of the face.
Awesome. Let's talk a little bit about anti-wrinkles, especially those injections. How do they work, and what areas can they treat?
Yeah, sure. So anti-wrinkle, basically, it's a muscle relaxant in a very brief terms.
Right.
Mainly, we inject it inside the muscle to relax this muscle. So the most areas where we use it will be the frown lines, the forehead, and around the eye areas. This is most of the uses in that areas. They basically block the transmission of the signals between the nerve and the muscle, and that's how they
Right.
work.
But a lot of people, doctor, are concerned or worried about the frozen look after they do these anti-wrinkle injections. What do you say to these people that are worried about this unnatural look, if we can say?
Yeah, look, I'm certain everyone have seen, in the street, in the shopping centers, people
Right.
with a bit of a frozen look. No, I believe, yes, it shouldn't happen. I can see sometimes people ask for it. Very minority of people, they
Okay.
like things to be too tight. But
So basically overdoing it.
yeah,
Yes,
yeah.
all right.
So we don't want that. I always stress on the natural result.
That's true.
The idea is not to freeze the muscle. The idea is to make your face look natural and relaxed. So I try to avoid at all cost.
Amazing. What's the difference between this anti-wrinkle injection and the dermal fillers?
Yeah, that's a good question.
Yeah, what's while we're asking this question, when do you prefer doing one over the other?
Yeah. So as we said, with the anti-wrinkle, it's mostly the upper face,
Right.
but still dermal filler have a very important place, mainly in the mid face and the lower face.
Okay.
So, for example, I'll give you an example. If someone have lost weight and lost some fat mass in the face, we use dermal filler, which is like a gel, hyaluronic acid gel, to restore that fat loss. So we inject it in certain places in the mid face and lower face to give that volume back and give the most important hydration. So hyaluronic acid is a very good hydrator of the face, and most of our faces are dehydrated. So firstly, it lifts, it fills up a bit, and it hydrates the face.
That is great work. But how long do these treatments typically last for, and do they have any downtime?
Okay, so with the anti-wrinkle, it takes about 10 to 14 days to fully show, and it lasts anywhere between 3 to 4 and 4.5 months.
Oh wow.
Yeah, but otherwise the dermal filler, it will last anywhere between 6 to 8 months, up to 1.5 to 2 years.
Oh wow.
So it is a little bit different depending on how thick a product is and where we're gonna use it.
Amazing. If I can go a little bit into the skin and hair rejuvenation, we have a lot of acronyms in here. So PRP, which is the platelet-rich plasma,
Yeah.
and the exosome therapy.
Yes.
They're really becoming popular for both the face and the hair.
Yes.
Can you please explain a little bit about
Yes.
these treatments?
Look, the PRP, it's been present for a while.
Okay.
Myself, I've been doing it for 7 to 8 years.
Oh, wow.
Yeah, it's basically getting a blood sample from a person, spin it at a certain speed, and get the yellow part, which is the plasma.
Okay.
So why is the plasma important? Because it has all the growth factors and the platelets.
Okay.
So that works by rejuvenating the skin. Even now we know it rejuvenates the fat pads inside the face.
So you re-inject the plasma of the person back in their
Yeah,
desired
that's
places.
right. That's
Okay.
right. So we can inject it in the skin, inside the skin, inside the face, on the scalp for hair
Wow.
rejuvenation. Yeah, that's a very good treatment and effective treatment. The other one, which is a bit newer, especially in Australia, is the
Yeah.
exosome, which are produced. It's like a vesicles. Basically, exosomes are like a transporter.
Okay.
So usually stem cells produce that. So it tells just the cell to divide and rejuvenate. So we get it from the outside. We don't take a blood test.
Okay.
It's usually in Australia, it's usually needled. So we do needling for the skin and then apply it topically. And that can be done on the face and on the scalp.
That's when the people look like they've been scratched by a cat. Is that how it is?
Yeah.
Yeah.
So the actual needling part,
Yeah.
yes, the face will get a bit red.
I saw some people. Yeah, that's interesting. But who is a real candidate, doctor, to do whether the PRP or exosome?
Okay.
Yeah.
That's a good question.
Thank you.
Firstly, how do we decide what treatment is best for a person? Certainly, we have to look at the history. We have to examine the face. We have to see the person, what is he's looking for or she's looking for. When we decide to do PRP and exosomes, we are looking to improve the skin
Okay.
and the structure under the skin. So it's not to reduce, dynamic wrinkles where someone is frowning. No, we use it mainly to improve the skin, as in texture, and it evens out the skin color, and it can reduce pigmentation. So it's a very good skin treatment, PRP and exosomes. Now, when do I use PRP? When do I use exosomes?
Right.
It depends on a few factors. Firstly, the physical health of the person. So, for example, if someone is taking lots of what we call anti-inflammatory medications like Voltaren and Nurofen, we tend not to use PRP because they
Okay.
can affect the platelet function.
Oh, okay.
Yeah, so we can go into the exosomes, which is usually not affected by that factor.
That is very interesting. You did mention about, injections being results can last for 4 months, the fillers 8 months to a year. How long does it last when you do PRP or exosome?
Yeah, so with PRP and exosome, it's a different completely than how the Botox and the fillers work. Mainly, each session we do, it improves the skin to a bigger level, to higher level.
So on the spot.
Exactly. So it works for a month or two after the session. Usually what we do is we do what we call initiation treatment, which is consistent of roughly 3 sessions a month
Alright.
apart. So we can consider that to be the initial treatment. After that, we can do what we call a maintenance, which can be one every 4 to 6 months, and that should be enough.
That is great. Another exciting treatment for skin hydration and elasticity is called Profiler.
Yeah.
How does this differ from the traditional dermal filler?
Yeah. So we had Profilo in the Australian market for about 2 or 2.5 years now. Interesting as well, we have the launch of a newer Profilo, which is Profilo Structura.
Profiler Plomax.
That's exactly the higher version of Profilo.
Amazing.
Basically, it's a mixture of hyaluronic acid.
Okay.
Now, the difference between Profilo and the usual dermal filler, which is also hyaluronic acid, is the linkage. So Profilo is not linked. So what we call, it's not cross-linked filler, hyaluronic acid. It's usually when we put it under the skin, it can spread and swim under the skin. While the traditional filler tends to stay in where we need it to be.
Oh, that's interesting. We've been talking a lot about fillers and anti-wrinkle injections, but what about tightening? Many people are looking for ways to lift and tighten their skin without surgery, as we mentioned. There is something called PDR threads.
Yeah.
How do they work?
Okay. Look, skin tightening is the $1,000,000 questions. Everyone asks for it.
I want to stay young.
Because as you know, the skin, then skin structure is the essence of anti-aging. So no matter how much anti-wrinkle we do, how much dermal filler, if we don't look after the skin, we're gonna age no matter what we do. So anti-aging, basically skin tightening, mainly very simply depend on our collagen. So
Alright.
there is something called collagen and elastin in our skin.
Yes.
How, the more we improve these and preserve them, the better results for later.
Right.
So one of the treatments, there are many treatments for.
I'm trying to
skin
tackle
type.
most of them. I'll do my best.
Yeah, I will start with PDO,
Yes.
which is a kind of a thread.
Right.
And PDO has been used in surgeries for many years, and they noticed that they work to tighten. If someone had a surgery and they had stitches, then they looked at the wound a few years later and it's still tight. So
Discovered
that's
by
how
accident.
they discovered.
Amazing.
Exactly. So we inject it under the skin. There's 2 kinds. One is short, one is long. The short one is we insert it under the skin to improve collagen.
Right.
It usually takes a few weeks to work, and the result will last a few months, between 6 to 9 months. That's for the mono PDO, what we call on the short. The lifting PDO, which is mainly the long ones, where we use to lift up the face. So they last anywhere between 6 months to 18 months, depending on the skin.
Amazing. I'm sure people will say, oh my God, thread inside my skin. Are they biodegradable? Like, do they
Yeah.
degrade in our
Yeah.
skin?
So the good thing is that we don't need to take it out. Physically, the thread will dissolve by itself in a few weeks,
Okay.
but the result of it will stay a few
Will
months.
stay.
Yeah.
There's other stuff, doctor, as well, that are popular for skin tightening. Something called RF microneedling and HIFU.
Yeah.
Can you please give us an idea?
Yeah. That's also a very popular treatment. Now, RF it's my favorite treatment to me. It's called radio frequency microneedling. So basically, it involves a machine which can insert the needles inside the skin at a certain level.
Yes.
At the same time, it releases the radio frequency, which is the main factor for collagen stimulation and tightening.
Wow.
Now, on the other side, the HIFU, it stands for high intensity focused ultrasound.
Right.
It doesn't involve any needles.
Okay.
So it's basically works, it's an ultrasound machine where it works on different layers of the skin. We start, for example, if we need to lift, we start with the thicker cartilage where we target the muscle. We have a muscle in the face called SMAS. So that's how it works. And also, if someone needs to slim a little bit in the face, we can use it at a certain setting which can do that. So both are a good treatments.
Amazing. All of these sound like good and updated and very popular as well. But if I was one of those females watching us now and say, oh my God, they're all great, but which should I be doing?
Okay.
What would you tell her?
Yeah. Look, that's the most important step, I believe,
Right.
in the whole aesthetic industry. Firstly, what I think is seeing, a medical professional is good to start with. Because, for example, myself, I'm a GP before being a
Yeah.
cosmetic physician. We have to know about the medical history.
Right.
So we have to look at few factors: medical history, any medications they're taking, anything which might affect certain treatments or not.
Right.
But assessment of the face is the very most important thing to do. Once I look at the face, see the medical history, and then we put a plan. For example, for this particular client, we need to improve her skin. So that's why we look after we look into the skin treatments, which can be, as we said, PDO threads, which can be RF microneedling, which can be PRP. So we target the skin area by different treatments. While if someone have good skin, is younger, we can do something more to rejuvenate the skin.
Right.
So we decide depending on the face, the age, and medical conditions.
That is spot on to the answer, Doctor. Thank you very much.
welcome.
Now to the part that I am very interested in. Non-surgical body contouring treatments.
Yeah.
They have gained a lot of attention. How do they work and what areas do they treat?
Okay. Look, body contouring have evolved a lot.
Right.
And there are always companies trying different ideas how to tackle that
Right.
stubborn fat mostly. So when we speak body contouring, there's machines which work on ultrasound, there's machines which work on microwave, and there are some skin tightening treatments as well. What we all aim, we always have some fat inside certain
please,
places
they're everywhere. Yes.
that we need to target. Now, we have good machines nowadays to target
Right.
that. Basically, we need some to reduce the fat and do some tightening of the skin. Still, we can use some treatments from the face, for example, threads or RF on the skin once the fat is reduced.
Amazing. Can body contouring treatments actually help with stubborn fat, or is it just for skin tightening? You did mention there's fats here and there, but the stubborn ones, these are the most annoying.
Okay, look, one of the machines I like is
Right.
works on heating the fat and to a certain degree where the fat cell pops out.
Oh, wow.
And then the body will recognize the fat and come and collect it. And in that way, we reduce the fat. And yes,
Right.
I can tell you that we have done treatments for people and we can, measure the circumference, we can measure the thickness of the fat. So yes, we can deal with those in terms of fat reduction and skin tightening at the same time.
Wow, how much science has evolved throughout the years. That's amazing. Apart from treatments, what are some habits that people can adopt, in your opinion, to maintain this healthy skin and slow down aging?
Yeah, that's very important as well.
Thank you.
Basically, what we need to do is look into a routine skincare. So that's a very simple step that we can do at home. It takes you like a few minutes morning, few minutes at night
Right.
to give the skin the nutrients it needs. So when we say about that, for example, briefly, we need to hydrate the skin. So
Drink
most
water.
people have exactly. Drinking water is very important. Even your diet is very important. So collagen in our skin is a kind of protein. And we're seeing nowadays people are losing weight or they're taking certain medication where they lose the fat and they don't eat much, but at the same time, they're not having enough protein. So you see someone lost a lot of weight, but unfortunately they get hair loss, they get skin tiredness. So we stress a lot about diet, about drinking water, about exercise, about sleeping well, about not smoking.
I know.
So there are many factors. Regarding skincare, that's extremely important.
Right.
So we need to give the skin the nutrients it needs. Most of the studied creams will be something including vitamin A, which is retinol,
Right.
hyaluronic acid, vitamin C, and niacinamide. To me, these are the active ingredients which most of the people should use.
I'm sure a lot of females watching us today would say, I go do these at the clinic so I can get rid of the good habit because I hate gym. I don't drink a lot of water. I'm not, or the creams are not doing much of a job for me in the morning or at night. And that's why I'm visiting Dr. El Khoury today or whoever else. So what would you tell them about that? I know balance is good, but why am I supposed to do this if I can go to the clinic and do it at yours?
Okay. Look, what I stress mostly about, especially if someone needs some hyaluronic acid filler,
Right.
because the hyaluronic acid by itself needs water to integrate and work properly. So I always tell them the idea of looking after ourselves in general. So lifestyle is very important, diet, exercise is important, but don't ignore the basic stuff. So doing treatments is good, but if you're not doing the right stuff for the skin, you don't see the full result of the treatment.
Amazing. Thank you, doctor, for this. I'm gonna do a little game, if you don't mind.
Yeah,
It's
sure.
going to be like busting some myths today. A lot of people don't know the real idea or the fact about some things that we do, especially in cosmetics. So if you can tell me if it's true or false about a little sentence that I'll read, and please feel free to explain it for us if needed. If you stop getting anti-wrinkle injections, your wrinkles will get worse.
False.
False. All right. No need for any explanation.
Look, I say something briefly because
Yeah.
literally I hear this question once a week at least.
Okay.
So when someone look after the muscle in that way and get anti-wrinkle treatment, it helps relax the muscle. And then some people will do it for 3, 4, 5, 7 years. And then
Right.
for some reason, if they decide to stop it, so they stop doing the treatment. And then they see the face, how it should look. So the anti-wrinkle was maintaining their beauty and their youthfulness. Once they
okay.
stop it, they see the usual skin. But still, the anti-wrinkle is anti-aging with treatment. So
It's false.
that's false, yeah.
All right. Dermal fillers stretch your skin and make it sag over time
False as well.
as well. The same idea of the wrinkles.
Yeah,
anti-wrinkles.
now with this statement in general, just I want to stress that it should be done the right way.
Right.
Yeah, so there are fillers which needs to be placed in certain places of the face.
Right.
They can be thick, or sometimes doing the wrong filler, it
Can sag it.
It can affect a little bit. Yeah.
Okay. The next one is aesthetic treatments are only for women.
No, that's not true as well.
Okay.
So day after day, we are seeing more men coming to our clinic.
That's interesting.
And if you see at percentage for the current, last 2-3 years, men
Right.
aesthetics is skyrocketing.
Oh, wow.
So maybe we'll outtake you very
So
soon.
definitely it's not only for women.
Yeah, that's right.
My next question is non-surgical procedures are very painful.
That's a false as well.
Wow.
So it depends on a few factors, but in general, they are very well tolerated. The actual hyaluronic acid dermal filler has some anesthetic inside it. And if we think the procedure it might be a bit painful, we use NAMI cream before. So give it enough time.
Amazing. My lucky last question. There's a lot. I'm sure people watching us, they'd be like, you didn't ask about this one. We barely have time, guys. Skincare products can replace the need for aesthetic treatments, which I think you tackled that earlier.
Yeah, so no.
No.
They combine, they work together.
It's a balance. Amazing. Doctor, believe it or not, this is almost the end of our conversation today. But a lot of people have a lot of questions. They want to learn more or they want to treat themselves nicely.
Yeah.
Can you please let us know about your services, booking consultations, and where they can find you?
Yeah, sure. So I am located in Bankstown area. So
Right.
my clinic is called Sydney Esthetics. We are located on Suite 15, 1 Jacob Street in Bankstown. So we welcome new patients, and I do offer a free consultation at the start,
Nice.
so that people can ask the questions. I can explain what we can do, and we can go from there. So usually I reserve the first session to do some planning, to assess the phase and talk about the plan, and then we can book out from there.
That is great. Thank you so much for joining us today. It was an insightful discussion, and it's been a pleasure learning about aesthetic medicine to help people, learn and feel their best. We thank you again for taking your time at Oz
welcome.
Arab Media. I hope to see you again
Thank you,
in our
Christine.
show. Thank you very much. And to our listeners, before we leave, whether you're considering a small enhancement or just curious about the latest enhancements in skincare, always do your research and choose a qualified professional. That's all for today's episode at Scientifically Speaking on Oz Arab Media. Until next time, stay informed, confident, and take care of your skin. See you later.